This healthy living tip is brought to you by the Christ Hospital.
Women are so busy, and whether they're taking care of other people, their kids, their parents, their co-workers, we need to take time and make an appointment for ourselves. Make the appointment and keep the appointment. If you're doing annual routine preventive medicine, that's where we screen for things that can be treated before they can become a real problem. There are signs that should not be ignored. Anything that you think is persistently different or doesn't feel right, even vague things such as vague abdominal pain, just feeling different, it's worth seeing a doctor for. But things that you shouldn't ignore include things like lumps in the breast, pregnancy, postmenopausal bleeding. Those are no-brainers. Go see your doctor. Even after you're done having babies, even after you've been through menopause, there are still health maintenance things that as gynecologists we do, including detailed exams that can look for malignancies and things along those lines. At Christ Hospital, especially in this department, we pride ourselves on confidentiality, and we follow all of the strictest standards that are set regarding patient privacy. And here at the Christ Hospital Obstetrics and Gynecology Associates, we have two locations, one at the Mount Auburn office and one at the Anderson office that's new by Christ Hospital. At both locations, you can get everything in one stop: pap smears, prenatal visits, annual exams, mammograms, and lab draws. Women are recommended to do both a self-breast exam monthly, and if you're still having periods, the best time to do it is right after your period. What you're looking for there are any changes in your breasts, any lumps, bumps, abnormal discharge, changes in the skin. Should you find anything, you can contact your healthcare provider immediately. A primary care physician is still a very important part of a person's health care, regardless of whether they have a gynecologist or not. This is the person who can do your sick visits when you're not feeling well, when you're having symptoms of pneumonia, when you're having heart conditions that are beyond the scope of an obstetric or a gynecologist treatment. So as part of the Christ Hospital Obstetrics and Gynecology group, we take care of women through their whole life. And some of the routine screening that we do through those times would be pap smears starting at age 21. These can be spaced out during the 30s if they've been normal. At age 40, you can start getting mammograms, which we can order for you and do on site. In the mid-40s, we can do things like screen for diabetes or high cholesterol. At age 50, we can order your screening colonoscopies and screen for thyroid disorders. And at age 65, we would recommend scanning for bone loss and osteoporosis. And we do these annual screenings for a reason. It's because the sooner a problem is identified, the sooner it can be treated, and the better the outcome will be. If a patient waits longer than they should for a screening test that could have been done earlier, the outcome could be worse. The best thing you can do for yourself is preventive medicine. It's better to identify something up front so that it can be treated early as opposed to waiting and having to react.
The Christ Hospital Obstetrics and Gynecology Associates, 2 locations, Mount Auburn and Anderson.